We're beginning a new year with a new crisis. The scale of the coronavirus pandemic has shifted in recent days in ways we haven't seen before. Fueled by the Omicron variant, the virus is quickly spreading and setting records across the country. Look at this. New confirmed cases shot up to more than 1 million on Monday, according to the numbers from the Johns Hopkins University in the U.S. That includes a holiday backlog because of New Year's. But look at this trend and the surge from just last month. It's not just about cases, though. Hospitals are really feeling the crunch right now. COVID hospitalizations are up 60% in the last week nationwide, according to the CDC. Local hospitals are back to caseloads they haven't seen in months. Many are quickly filling with COVID patients, the vast majority of them unvaccinated. But here's what's different this time around. This is a crisis doctors say we can fight.
If we don't take the rules of infection control seriously, this curve will bend us. We have a choice, and it's a hard choice to make, and I know there's not much political willpower out there for this, but I'm telling you, if we don't find the willpower, the virus is going to find us. That's not what we want to see.
So what's the problem here? Health experts say low vaccination numbers paired with lax masking in our two states is letting Omicron run rampant. And again, severe symptoms are largely affecting people who aren't vaccinated. And don't forget schools. Thousands of students in our area went back to class last week, many of them caught in policy battles on masking waged by politicians and angry parents. Right now, school systems are feeling the fatigue.
There aren't mask mandates anywhere else. Our kids go, at night, wherever they want to go, weekends, wherever they're going to go, and are doing that in a large capacity of being unmasked. And so therefore, there's this burden that schools carry, and I think hospitals carry, that we're the only ones fighting the fight.
Right now, a number of districts are revisiting their health and safety policies. Some are staying the course, using a playbook written before Omicron came our way. And in many school systems, hands are tied either by court rulings or threats of legal action. Here to walk us through the challenges and get to the heart of a matter of public health is Kenny Southwick. He's the executive director of the Cooperating School Districts of Greater Kansas City. Kenny, thanks so much for joining us. You work with more than 30 school districts on the Missouri side in our area, 183,000 students. How do you tackle this new problem? What's the thinking here?
Well, so I have my mask this morning.
You do?
And a couple of months ago, I didn't think I'd need it, but through the 22 months that we've been doing this, we've had to pivot a lot, and we've had to change the direction that we take based upon data, but also, as you mentioned, legal action that's been taken across the state, and all of that figures into our school boards in terms of the decisions they make to keep our kids safe. So.
A lot of pressure from Missouri's Attorney General, especially right now with these school districts getting cease and desist letters.
Yeah, so right before the vacation, many of our districts that had mask mandates in place received a letter from the Attorney General to cease and desist under the threat of a lawsuit, and we've seen action that's been taken over the last several months with respect to mask mandates, and we're likely to continue to see that. So that's one of the pressures our boards face.
I imagine that has to be frustrating. Dr. Steve Stites, who we heard from just a moment ago, said a few days ago he believes Kansas City is about 2 weeks behind many of these larger East Coast and Midwest school districts shutting down. How do you prepare for that?
Well, that's been the pattern since the very beginning when it broke on the East and West Coast. We saw it, 3 to 4 weeks. Now it's 2 to 3 weeks, and it'll be here. Our numbers are high right now across the region. And that's with vaccines and continuing to get, I think we're about 50% of our people that are vaccinated in the area. So it definitely is a challenge as we move forward to try to make decisions. I would tell you decisions that were made by our districts on Monday are likely to change by the end of the week and maybe even into next week.
I feel like we've been dealing with that for about 2 years now.
Yeah, 22 months we've been involved in trying to navigate, make sure things are safe. And I want to say, our school districts, our teachers have been heroes, our board members and administrators have been heroes. This has not been easy, but they're going to continue to look at the data and the information and make decisions not based on a lawsuit, but based on what they think is going to be safest for kids.
Well, we talk a lot, this is a heated issue for many reasons, right? But you have school boards versus parents versus politicians going on, just on many, many facets of this argument. How do you navigate that and try to tell parents, look, we're just trying to do what's safe for the kids and for our workers?
Yeah. From our position with Cooperating School District, we try to provide information with 32 school districts, 7 board members for most of those, and lots of administrators and lots of communities. I can't tell 30 districts what to do. But we can lay information out for consideration, and that's what we'll try to do. These work. They're not comfortable. Nobody likes to wear them, but they do work, along with the other mitigation things we're involved in. You know, we're 6 feet away today.
Right.
And, you know, we might not have been that way, like I said, a couple of months ago, but that's where we are now. And we're going to continue to wash our hands, social distance, try to keep people in groups and separated. And the most important thing is that my recommendation is talk to your physician, understand what vaccinations do, and then make your own decisions.
What's your biggest frustration right now?
I think it's politics and social media. It's been a pandemic of false information, and that's accusatory on both sides. So being able to get the true information out, that's frustrating. The number of people that we have that have ignored the science personally bothers me. As I look at whether I get the virus or not because I didn't get a vaccination, but when I get deathly ill, I'm running to the hospital, and then I trust the physicians, and they're overloaded right now. So that's really frustrating to me.
Do you think that school districts across the board should require masks right now?
I think those are individual decisions that each of these communities have to make.
But what do you think?
What do I think? I would tell you if I was running a district today, and I'm not, but if I was, I'd have a very serious conversation about the strength it takes for school board members to make what they think is the best decision, knowing you're not going to make everybody happy, but let's keep kids safe.
All right. Well, we appreciate the difficult conversations that you're having with those districts and with us today. Kenny Southwick, thanks so much for your time.
Thanks for having us.